Why are pancreatic biopsies sometimes inconclusive? Have you ever wondered why pancreatic biopsies can sometimes yield inconclusive results? This question is important, especially when it comes to diagnosing pancreatic cancer. There are several reasons for this, and understanding them can help demystify the process. First, the size of the lesion plays a significant role. When lesions are smaller than 2 centimeters, they can be challenging to target accurately. This can lead to inadequate sampling, resulting in unclear or non-diagnostic findings. If the tumor is small, it might be missed altogether during the biopsy. Next, let's talk about tumor characteristics. Larger pancreatic tumors can develop areas of necrosis, which means they have dead tissue inside. Samples taken from these necrotic areas lack valuable tumor cells, making it impossible to diagnose cancer accurately. Additionally, some parts of the tumor may be rich in blood vessels. If these areas are sampled, blood contamination can obscure cancer cells under the microscope, complicating the diagnosis. Technical limitations also come into play. The biopsy needle or brush may miss the actual tumor cells, especially if the lesion is hard to visualize or access. This can lead to a sample that appears non-cancerous, even if cancer is present. The common method used, called endoscopic ultrasound-guided fine needle aspiration, can yield inconclusive results about 10% of the time. Interpreting the biopsy results can be tricky as well. Even skilled pathologists may find it difficult to identify pancreatic cancer cells, particularly when the sample is small or contains few tumor cells. In some cases, the biopsy may suggest cancer but cannot definitively rule out rare non-cancerous growths, leading to uncertainty. Interestingly, studies show that inconclusive findings are more common when the final diagnosis is benign. This indicates that the biopsy may not capture malignant cells if they are sparse or absent in the sampled tissue. Blood contamination is another factor. Sampling highly vascularized areas can lead to blood obscuring tumor cells on slides. To improve diagnostic accuracy, advanced techniques like contrast-enhanced endoscopic ultrasound-guided fine needle aspiration can help visualize blood flow and avoid problematic areas. When initial biopsy results are inconclusive but there is still a high suspicion of cancer, doctors may recommend repeat biopsies or alternative sampling methods. These could include endoscopic retrograde cholangiopancreatography with brushing or computed tomography-guided biopsy. However, each of these alternatives comes with its own risks and limitations, such as pancreatitis or the potential spread of the tumor. In summary, pancreatic biopsies can sometimes be inconclusive due to factors like small or necrotic tumors, sampling errors, blood contamination, and challenges in interpretation. Achieving an accurate diagnosis often requires careful technique, sometimes repeat sampling, and correlating findings with imaging and clinical data. If you have concerns about pancreatic health or cancer, it is always best to consult with a healthcare professional for personalized advice.